reason why I'm here, right? Because our Memorial Myanmar ID like IT department had a system audit, and they audited all the nurses, how compliant we are in barcoding before medication administration. So now, due to statistics that I put in here, the average barcoding person, the lowest is 1.40%. So there's 3 nurses who is 1.40%.
What do you mean, 0%?
1.40%. 1.4%. And the highest is 99.55%. These are the report dates that we did. That percentage of administration where patients were scanned before giving is 95.73, and percentage of administered where meds were scanned before giving is 94.9. So we give so much medication that most of nurses, they don't really use barcoding anymore. They do the bypassing before administration. So why these are the facts and figures about why we really need to barcode. Medication error result in at least 1 death per day, and 1.3 million injuries per year in the U.S., and 7,000 die each year due to medication error. 400,000 preventable, because this is a preventable issues, drug-related injuries every year. And the serious injuries is about 35,000 in 1980 to about 90,000 in 2005. And per injury, 3.5 incident per 1,000 medication. So per injury or per adverse reaction is 4,600. If you have 200 in your facility, the facility will spend almost 1.2 million annually for the medication error. So why re-education is important? Number one, because we have to increase patient safety, increase patient satisfaction. We're accredited with JCAHO. To have accreditation to JCAHO, we need to be compliant with this, and of course for reimbursement purposes. And we need to adhere the standard of practice that the memorial. This is the policy of the memorial, that all the medication needs to be given. We have to barcode the medication prior to administration. It's simply written in our policy. We really need to barcode.
So what are they doing? I mean, whoever's doing it, so what are they doing when it comes up with the reason? Are they scanning it all?
But here's the why we are not utilizing it. Some nurses, it says when they give the medication, they have workaround bypass reason. They said scanner is broken. It's 3.57%. System downtime is 0.87%. Actually, some nurses says in the PICS pulled by MD 0.94%, and to the fact that doctor doesn't have any access to give medication. And it says barcode is unreadable 29%, and scanner is not available. So we really need to be proactive in barcoding, because it's very important. Number one is the accreditation, is especially reimbursement purposes. So we need to, my goal is from 1.4%, we need to be at least 95% to 99%. One nurse only barcode 99.5%. That means only one of all the nurses in the emergency room, unfortunately. So I have to, my goal is to re-educate all the nurses to be compliant with barcode medication administration. At least I have to do this for the next 6 months. I have to talk to you about, reminding you once a week about barcoding the medication prior to administration. And just look at the facts. If we don't barcode, this is what we're gonna be ending. Our medication error liability, which is 4,600 per patient. If we have 200 errors, it's going to be 1.2 million. Miramar will cover that. If we're gonna have a lot of medication errors.
That include the saline flushes?
Yes. Saline, normal saline flushes are medication. So I'm gonna talk to Vera because it says there the IT what's his name Wasim said that most of the nurses when they bypass medication, it says no scanner is broken and there is no scanner is not available. So remember, all the rooms has computer, so there is no way that we don't have any scanner at all.
Well, sometimes they do break. I mean, you can always get,
You can always hit the wall.
We have the wall, the wheels on workstation, and the handheld one, and each computer in each room has a computer. Who so far I never heard anything that computer broke. So
sometimes they do break, I've had it.
There's sometimes problem with computer, we have to call IT and fix it.
Yeah.
Put a work order in.
Then,
And there's
we
no way
get
to comment on
yeah.
that, yeah.
Yeah, it happens.
It
Yeah.
happens.
So you
Yeah.
have to get a wow and stick it in the room.
The wall, yeah.
yeah.
Again, something that I've noticed is, especially when you have to give a push medicine and the patient's got a saline lock and that, you're always having to when you've always got to pull out the saline flush, okay, do Pyxis, and it comes up as an override. The doctors, it needs somehow to tie in the IV push meds with a automatic saline flush, and if you don't pull it or don't use it, so be it. But you're always pulling, whenever you pull a saline flush, and I know a lot of us have a tendency to go in, grab a handful, put them in our pocket, and go on. But, it's still, that's a medication error. If the doctor charts to give Zofran 4, you're not just gonna push Zofran 4 into a saline lock and not flush it with something, the medicine's stuck in the saline lock. Okay, so there needs to be an order, the doctors need to put in an order for the saline flush to be administered, so when you scan it, you're not having to put in another order by Dr. Villegas for a saline flush.
But actually, it's standard already. Some of the medication has already like saline flush their order.
Right, some of them do, but not all of them. And this is the issue, when you pull the saline flush, then you have an override.
Yeah. So I'm gonna talk to the doctor with that issue as
We
well.
also need to give medics access to the saline box. I mean, this-
Right now, they're not covered to push anything in
Yeah.
this facility.
Not in the facility.
Not at the health nurses.
Only regional.
So we have to improve, guys. Okay, 1.4% to 95%. That's our goal, to have this at least to be accredited by JCO. JCO is looking at that. That's why Wasim was doing a system audit because of that. Nurses needs to be compliant with the barcode medication. Any question?
Thank you very much.